Good morning, everyone. Good morning. It's good to see you all today. I'm extremely excited and honored to be able to moderate this panel, very esteemed panel. As Nicole said, my name is Terry Davis Merchant. I'm the Program Director for Housing and Homelessness Grant Making at Trinity Church, Wall Street. We are proud funders of New Destiny Housing. I want to first allow our panelists to introduce themselves, and I'll start immediately with Commissioner Noel.
Good morning, everyone. Can you hear me well?
Yes.
Oh, good morning.
Good morning.
Energy out there. It's really good to be here. My name is Cecile Noel, and I'm the Commissioner for the Mayor's Office and Domestic and Gender-Based Violence.
Hello, everybody. I'm Kelly Owens. I'm the Executive Director of the New York State Office for the Prevention of Domestic Violence.
Great. Thank you both so much. So before we get into the sort of meat of our panels, first of this panel, which is addressing the health consequences of domestic violence, I want to sort of take a step back a little bit. As I'm sure you both know, more than 4.6 New Yorkers across the state will experience abuse by an intimate partner in their lifetime. While domestic violence is considered one of the most underrepresented and underreported crimes, the NYPD filed an average of 31 domestic violence incidents reports per hour in New York City in 2022. So can you sort of talk a little bit about what your agencies and sort of your other government partners and government entities do to support and survivors, and sort of what resources are available to them? So in case folks don't know.
Okay, so I'll start. Again, my office is the New York City Office to End Domestic and Gender-Based Violence. And under that rubric, we are appointed, we serve all of New York City in really thinking about how we can think about policy and resources for survivors of domestic and gender-based violence. Under our portfolio, we directly manage the family justice centers, which are located in every borough, that provide a whole host of services for survivors across the spectrum of domestic and gender-based violence. So that includes sexual assault, harassment, family violence, all of those services one can access through our family justice centers. So what are some of the services? We provide mental health counseling, advocacy, legal services, immigration legal services, just a wealth of services, as well as being co-located with the district attorney's offices. So survivors who choose to pursue a criminal justice action can do that easily. You don't have to do that to be able to access our services, but certainly you can do that and do that more quickly and easily through a family justice center. We advocate for the courts. We have prevention programming in high school, middle school, and now a curriculum online, so that we can think about how we really prevent domestic and gender-based violence by educating young people to think more holistically about their behaviors and resolving conflict in healthy ways. We also have programming that's looking at that abusive partner. How can we think about this differently? How can we help those who cause harm in community to be able to respond in healthier ways? Again, with the survivor at the center of that conversation, ensuring that there is safety there. How can we help those causing harm do better? That's just a snippet, but I would encourage everyone to really go to our website, look at all the services that we provide. We are advocating with all of our city partners around policy every single day to improve access, to improve resources across the spectrum of the city around domestic and gender-based violence.
So OPDV is a small but mighty state agency. We've been around about 30 years, and essentially we're the counterpart to Cecile, but Cecile provides direct services, which OPDV does not do. We fund direct services in the area of, we run the hotline, and we also run a hotline. We run the state sexual and domestic violence hotline. But our job as a state agency is to really work with other partners in the state, as well as the governor and the legislature, to look at the state's response to domestic and gender-based violence. And over the past 3 to 4 years, we've really focused in on how do we get cross-system buy-in and how to become more survivor-centered, trauma-informed, and culturally responsive. And really moving the system that was built 20, 30 years ago to understand that it's time to kind of look more broader. So we've been really dedicating a lot of our time at the Office for the Prevention of Domestic Violence, talking to other systems, talking to survivors. We've now instituted a survivor listening program at OPDB, which makes us go out and talk to folks every day to understand how is the systems that they interact with helping them. So we've also instituted domestic violence regional councils across the state, which brings together the provider community and all those systems that you can imagine. Courts, police, hospitals, education, to come and see how is your community responding to domestic violence. One, how can we do it better? What are the barriers that the state can reduce to the best of our ability? And what are the policies that the state should be considering to make a better system? So we don't do the direct service that Cecile's office does here, but we're kind of that driving force and trying to drive better.
Great. And I want to say that it's really encouraging to hear both of you say that you look across systems and sort of this recognition that domestic violence is not just a criminal justice issue, it's not just a healthcare and interrelationship issue, it's multifaceted. So I want to say thank you so much for just having that thought leadership and really thinking holistically about survivors. So again, it's sort of another question to frame us. And I think Borough President Gibson did a really wonderful job in sort of setting the stage for this particular question, but we know that domestic violence affects everyone, but we also know that it disproportionately affects women and people of color. It also means it affects immigrants particularly strongly as well as people in other marginalized communities. And I was wondering if you could speak to some of the initiatives that you have at both of your agencies that are culturally responsive, linguistically responsive to people in these particular groups, because I think it's really important that our service providers, government, really think about sort of the different ways in which we're intersectional and in which survivors are intersectional people. So.
Yeah, so I go back to what I said earlier, right? We built a system 30 years ago and we left a lot of voices off the table. And I think we have a long way to go to be more inclusive within the system and how that system responds in a culturally responsive way. We got work to do. I will say that we have language line that's supposed to be provided at all our services. I want to talk specifically about a pilot program that OPDB is doing across the state in regards to the LGBTQ community, which is traditionally not felt considerably welcome or in the systems across the state. And I will say New York City is always very special, and they're a little bit ahead of the curve. So when we're looking at a lot of programs, we're often looking to what's the city doing and how can we get folks across the state to kind of embrace some of those things. So OPDB about a year and a half ago started an LGBTQ endorsement program where we're working with ABP to say, okay, what standards make this a LGBTQ inclusive space? So we're working with about 5 providers across the state who voluntarily came into the program and really working with them on standards. So what are the standards that should be in place across all of the provider community in regards to how do you make yourself competent and welcoming and understanding how to serve the LGBTQ community. So we're working with that. We've also, I mentioned survivor listening sessions, which are really key to how we're driving change within the system and really have concentrated on more culturally responsive providers helping us do that. And we're also involved in an Engaging Men and Boys campaign at this time, really talking to young men, as Cecile mentioned earlier about accountability programming, and really understanding how do we do that in a way that isn't just criminally justice-based. We had a great panel last week at SU with a lot, there were about 50 young men and lots of men of color having a conversation about their experience about masculinity and what does masculinity look like, and modernizing the thoughts around that. So that's just a few things.
Here in the city, just like at the state, we also have our own language lines so that no matter the language you speak, we will be able to service you. And that is in fact a local law for us. So there's really a compliance across all city agencies to do that. So, and we also try to get out there all the time that our FJCs, which are across the city, our customer-facing services are open to all, regardless of language and age and immigration status and sexual orientation. We are open to all and provide all services, and all of our material really stress that very heavily. We also contract with community providers, and over these past couple of years, we have been intentional in our goal of really ensuring that the services provided in the family justice centers reflect the communities that we serve. And so we have been clearly intentional in the dollars allocated to us to provide service to ensure that those dollars are going to community-based organizations to work in our spaces that clearly understand the communities that we're serving and clearly reflect both the cultural competence that is so important. When we think about boroughs like Queens, where we have so many cultures and languages, to ensure that we have providers in our space that really understand that and can provide those services in culturally competent ways are truly important to us. We also have survival voices, just as Kelly talked about, that are guiding our services all the time. We engage folks who've used our system to come back and tell us what's wrong, what can we do better, how can we improve these things, and so we're doing that as well. And so we have a group that is called Survivor Voices, and they're actively participants in our programming as well as leading us from a policy perspective. And then finally, we are deepening our relationship in community with organizations that are not in the DV lane, because we're not going to end this just by talking to our partners. We have to talk to other organizations that are not in this lane to help them understand domestic and gender-based violence, and to help those organizations deepen their work and understand their connection. Like in the gun violence arena, we understand that connection, and we are working with those community-based providers who have a deep foothold in gun violence to understand the intersection between this issue and realize that they'll be talking to someone who might have access to a gun and might do something on the street, but that person's probably also doing things at home. And we need to make that connection. We need to be able to understand our role and understand the resources available and work together so we can deepen that work as well.
Great. You know, two things that jumped out at what you both said. One is the sort of concept of welcoming, right? One of the things I've learned by talking to New Destiny and some of our other grantees that work in the DV space is really that initial welcome feeling that many survivors need. They're coming, they're so brave. Our survivors are so brave. And so having that initial space where they feel comfortable, whether it's someone that they feel culturally connected to or linguistically connected to, is so important, so thank you. And also, again, I'm feeling like this intersectional sort of interweaving of DV across systems. I'm loving this theme that they're already developing. We really need to know, yay. Okay, so let's get into the sort of nitty-gritty of this particular panel. I want to sort of switch a little bit over to really talking about health and health outcomes. Research shows that survivors are 31% more likely to develop cardiovascular disease and are 51% more likely to develop type 2 diabetes. At least half of survivors experience post-traumatic stress disorder and depression. And so I was wondering, what interventions you all have seen in your work that you think that can help address negative health outcomes in survivors?
So, in fact, this morning, Health and Hospital is making an announcement about a major mental health initiative that will be specifically in DV shelter. So I'm not there for some people this morning. I say to everyone, no one knows me in July, but everybody knows me. Nobody knows me in July. That's right. And so they're making an announcement this morning about really rolling out a mental health initiative across shelter that's really focused not just on survivors, but on children as well. We know that children experience the violence, and really, the intent of the program is to really engage survivors early in their entree into shelter to begin to deliver, assess for mental health, and then deliver really the services that are needed. Mental health is critical. If we think about ourselves and living through violence in the way that survivors do, finding safety in places that they can, and then picking up their lives and going into shelter with 3 plastic bags your whole life, if used to them, and moving into shelter, that's what survivors face every single day. And so what that also does to them mentally and physically is tremendous. So again, this announcement is out there, but we are also working with our DOH partners as well as H&H again to ensure that survivors are assessed early on for these health initiatives or health issues, and connecting them to providers, community-based providers that can help to manage this. We know this is a problem. We know this is a problem even without the violence, because many of these are Black and Brown communities and marginalized communities who face systemic issues and have for generations. And so what we're talking about now is really an effort to really deepen that and connect those survivors to the services that are needed early on. And if the entree is shelter, so be it. In our family justice centers, we have a wonderful mental health initiative that's also doing that. It's assessing those folks who never went into shelter but also have domestic violence issues to really come in and see if there are, if there are mental health issues that should be addressed. But we also have deep connections to community-based health providers that we are referring them to, and doing that with one hand and follow as part of our work for the family justice centers.
Yeah, so at the state level, we've been working with DOH. DOH has established Office of Health, Equity, and Human Rights. And one of the first programs that they looked at was the rape crisis programs, and how the state was doing in regards to rape crisis programs. And I believe there is a report online if people want to take a look at that. But I don't think any of us are surprised to understand the stress and the circumstances in which survivors live affects their health, their mental health. I don't think that's a surprise to any of us. I think what has to happen is a realization within the medical community that when somebody presents to them, right, they're presenting with maybe this, but what is behind that person? What is the whole person experiencing? And that's, I think, and I would say that across systems, right? But when somebody's interacting with law enforcement, it isn't just that incident that they bring to the table. It's all of the stress and all the things in their lived lives that bring them to a place for help, whether it be mental health, or law enforcement. So I think there's a broader knowledge that we're trying to push. I think it's gaining ground. I think that people are understanding what folks bring to the table when they come before them. I think our job is to give them the tools to know what to do once that happens.
No, that's interesting. So sort of this idea of the way that we, and I think we're talking more about this as a society about the way we express in our bodies, especially the stress that we experience is internalized and what that does for our long-term health. And so I appreciate you both sort of touching that a little bit. We live in a society that we don't have universal health care, so we have to talk about the cost of health care, the literal financial cost of health care. So medical emergencies or other unexpected expenses put a lot of survivors at risk of losing their homes. Recently, the federal government included an economic abuse provision in the recently enacted Violence Against Women reauthorization in 2022. So as part of that, I believe the state allocated about $5 million for flexible funding for survivors in this year's budget. And the city enacted a microgrant program, which are wonderful things about company, for survivors. And this is important because up to 99% of survivors have experienced some sort of financial abuse, or more than half endured coerced debt. And so wondering if you can sort of speak about, one, the significance of these programs overall, but specifically how these programs can help address survivors who have medical and other health issues that they're trying to pay for.
So I'll start with the flexible funding, and then I'd just like to just highlight, where I should have. So during COVID was just, I think we're all living in, before COVID, after COVID, like, you know, that defining moment in society where you're like, oh yeah, that was before COVID, because COVID was such a big line for all of us. But for us, it also presented an opportunity. So we know that survivors who are at home with abusive partners were struggling with so many things. Calling providers were asked to figure out how to provide services on a dime in different ways, which we've embraced as well. And one of the things that we were able to really launch during COVID was what was on my program, or Flex Funding Program. That was privately funded. And we had wanted to do that for years and years. But we never had the money to do that. And lo and behold, COVID and private funding gave us an opportunity. And what did we learn? With approximately $800,000, we were able to give out grants to survivors, averaging around $1,200 approximately, to address some of those things that could be managed with quick access to dollars, turning around, that also promoted not only their safety, but their continued housing, right? So we really prioritize that. And I say that because access to dollars, access to funding is so important to survivors outside of the system. It's not to say that, you know, in 6 weeks you couldn't probably get it through maybe public assistance if you're on public assistance, or if that is, you know, an avenue that's available. But it does mean it's not going to address my situation now. And 6 weeks could be the difference between having housing and not having housing, between being severely harmed and not. And so how could we want something that could get these dollars to survivors faster to address many of the issues that you're talking about? What we also found is that those dollars were used to support things like keeping the lights on in. You're going to stay there if you don't have the lights on. Oh my God, you know, the laundry is down the street, is where the user lives. How can I find, maybe get a washing machine in my apartment? How can I do anything when the refrigerator is not working and the landlord won't fix it? And it's going to take however long to get another one. Access to funding can do that and keep you in housing and address some of those other issues around divorce debt. And so we know that those folks causing harm use every tool at their disposal, every single tool, to be able to coerce and harm survivors. So having access to those dollars is truly important. I'm happy to say that the city has also embraced that model and has allocated another $1.6 million for us to roll out a program long-term that will be doing that on a continual basis with community-based providers. So we're really happy about that. We're happy that we're beginning to think outside of system boxes. You know, you can get this in a box over here, but sometimes the needs of the survivors we see don't fit neatly into these boxes. Then what do we do? And so this is an ability, I think, of systems broadly to be able to do that. And the last thing, I know I have 2 minutes, is just to say that one of the other things that we're launching our help, so I'm jumping back a little bit, is to really look at strangulation. And just as Kelly said, about the assessment that's been done by EMS when they're coming to or reporting to or seeing a domestic violence survivor, to be able to ask questions and better deal with that assessment and figure out services.
Great. So this year, the state put $5 million in flexible funding into the state budget. The year before, OPDB had administered about $23 million that went out in about 3 months of pandemic emergency assistance funds. Those funds were somewhat flexible. You had to be TANF eligible and all that kind of stuff. But as Cecile said, this is money that the system has been asking for over a decade. To say, listen, we need dollars that will help right away, that will help stabilize people right away, without all the strings, without the focus strings, without the valid strings, that we can really get to people when they need it. So we're really excited. Everyone will have had to have signed up, the provider community, as of the 3rd, to access those dollars. Those dollars also allow for an advance, which is something that providers really ask for, so they don't have to carry kind of the beginning of the program. We're really excited about those dollars. I'm hoping to show how much those dollars work, along with the city's learning and their flexible, and really show that these are the dollars that we need to be investing in the system if we truly want to help survival kit stability much quicker.
Okay, great. I know we need to ask, and this has to be your 10-second elevator pitch answer. Yes. Housing is a social determinant of health. I'm a houser, I have to ask a housing question. Can you just specifically 10 seconds about how you've seen homelessness and affecting health for DV survivors? What should we be looking for? What should organizations like New Destiny be looking for? And so then you take this question.
I think 10-minute mental health is a really big deal. Housing and health connected. So for the survivors that New Destiny is working with, what does your assessment look like? You know, what are you screening for? How are you connecting those people when they identify the issue to the appropriate resources? And also, how do you bring those resources in-house, right? How do how does this organization think about incorporating mental health or maybe some health screening that can be done on-site in our housing?
Ditto, but I guess I would also say, I think all of us have to start thinking in an intersectional lens about the people that are coming before us, and not just looking at the problems we're looking to solve, but really looking at the person's